It's called Colorado's version of Obamacare. The Denver-based Connect for Health Colorado is the state's health insurance marketplace for people who are uninsured or underinsured.
And now a federal audit says the agency misspent nearly $10 million in grant funds. KRDO News Channel 13 Scott Harrison explains how it happened and what's next.
This is the 29-page report released by the Inspector General's office on behalf of the U.S. Department of Health and Human Services. It finds that Connect for Health Colorado, also known as the health insurance marketplace, should repay $9.7 million to the government because the agency didn't properly spend or document the money. According to the audit, the agency improperly awarded bonuses to employees and executives, approved spending for certain social activities, and required the use of personal credit cards for purchases while not fully disclosing possible conflicts of interest. According to the audit, in one particular situation, some of the grant money was used to buy equipment for a marketplace staff member who then kept that equipment for personal use after leaving the marketplace. The audit also shows the agency failed to document some costs, wrongly approved some spending for support and maintenance contracts, and improperly moved some costs between grants to correct accounting errors. The agency's CEO, Kevin Patterson, disagrees with the findings and is appealing them. He says the money is only 5% of its total funding. Patterson attributes the situation to receiving mixed advice on spending and accounting habits during the agency's startup phase in 2013 and 2014.
There's a lot of unknowns in how it's going to affect people.
Peggy Herbertson, the director of a Springs medical clinic, says she doesn't think the agency intentionally misspent money, but she's worried about the long-term impact on people seeking health coverage.
I think that the whole system really needed to be worked on, and that a lot of changes needed to be made. When anything is first put into place, nothing is perfect, and I don't think the time has been taken to really take care of those issues.
Herbertson says the marketplace has much potential for success if it can straighten out the trouble it's facing. Scott Harrison, KRDO News Channel 13.
The U.S. Centers for Medicare and Medicaid Services has up to 6 months to make the final decision on if and when